with your immune system when we have allergic reactions. As we know, allergies can be super frustrating. So, my goal today is to walk you through what's actually going on a little bit inside of the body and also to better explain why we have the symptoms we have and what are some viable solutions that can help us. All right, so I'm going to go ahead and just let's see if I can exit out of myself so you can just hear me talk. Okay. All right, so there has been some rising challenges lately. You might have experienced this yourself, but we are kind of going into this new era where allergies have been increasing. They've been increasing for older adults, and they've actually been increasing globally at any age. So we might be experiencing sensitivities later on in life. So these sensitivities actually go far beyond sneezing and congestion. They can go to affecting our energy, affecting our sleep, and our cognitive clarity. What this means for us is that allergies aren't just symptoms, they're not just sneezing, they're really an integrative part of the immune system, the whole body that includes the brain. Okay. Let's move to the next slide. So, what is an allergy, right? So, allergy is an exaggerated immune response um, that is a substance, it's an immune response to something usually harmless, a harmless substance like your pollen, your trees, your grasses, your weeds. And what happens is that the immune system encounters this allergen and it mistakenly identifies it as something that is much more of a threat. So then our immune system gets really amped up and it wants to produce a defense mechanism. Okay, so even though it's just dust, our immune system is like, no, this is something else. This is something really dangerous. And so it wants to pump up our immune system to get ready to fight this attack. Okay, so there's our mistaken identity. Okay, so and this is how this happens. So it's called the allergy mechanism. And there's like a couple different phases and what happens here when our immune system encounters an allergen or an antigen. So the first thing that happens is the initial exposure. It's phase one, it's sensitization. So that's when the immune cells, those are our mast cells, okay? Our immune cells notice the allergy for the first time. And then there's this chemical reaction that happens where these cytokines kind of say, "Oh, hey, look, there's something new. Let's switch on the immune system. Let's turn it on because we don't exactly know what this is, and this really could be something harmful for our bodies." And so the cytokines release this sort of immune system allergy mode, and then we make something called IgE antibodies. And so that's kind of what you see that little Y shape in the allergy mechanism there. That's an antibody. And so what it does is these antibodies attach to the mast cells and they prepare itself. Okay, we're ready to fight this whatever it is next time we see it because it's perceived as a danger. It could be perceived as, oh gosh, um, just something way more um like way more potent than just an allergy. Okay, like a virus or a bacteria. Okay, so it gets mistaken for that. So what happens is that these IEG antibodies attach to the mast cell, and then the next time we get re-exposed to it, we go out for a walk, we pet a dog, we're in a friend's house that has a cat. And then now the allergy, the cells are super prepared for this allergy reaction. So that's phase two. So the allergen comes back, it triggers these mast cells. Now these mast cells already have histamine in them. Okay, so they're already kind of ready to go. And so the antibodies, the antigen sort of, it's like a locking key. The antigen sort of locks onto the antibody that signals the mast cell to just trigger all of these histamines. Okay, so then we get the immediate symptom. So the symptoms that we get from the histamine is the sneezing, itchy, runny nose, coughing, swelling, all of the allergy symptoms that we can get. It's unpleasant, and so we get the stuffiness, the eye pain, or like some people get watery eyes, some people get itchy eyes. And so what happens in the background is that there's these cytokines, and they're still in the background, kind of going, I think we need to make more immune cells. I think we need to hang around a little longer. I think we just need to increase the mucus production, or we need to stick around because we don't necessarily know if the threat is actually gone just yet. Okay, so then we still have this switching on of the allergy mode um, happening in the background, and that's kind of our low grade inflammation. That's when our allergies last a little bit longer than we would like. It kind of just is extending this reaction of inflammation, this low grade inflammation that we're having. Okay. Here is another sort of 3D picture of the mechanism of allergy. So this slide is using antigen, um, and it can be associated with an allergen. Okay, and then and there's our mast cell, and those are like just the immune cells that are like on our skin, in our nasal passages. And so you can't see here, but the cytokines are sort of um, communicating that we need to make IEGs or IgEs. Sorry about that. And they attach to the mast cell, and then you can see sort of that lock-in key. The antigen locks into the antibody, and then it releases the histamine. So I just kind of thought that was a cool slide. Okay. So let's talk a little bit about what's happening in the background with inflammation and these cytokines. Following the histamine release, the immune system triggers this cascade of cytokines, signaling proteins that amplify the inflammation throughout the body. So it's not just our sinuses, our nose, or itchy throat. It actually starts to become systemic. This inflammatory response produces the symptoms of allergies, but it's much more than that. It's this underlining reaction that's happening in the background. It's this communication of bringing more immune cells, increasing more irritated production. Okay, so that's kind of what's happening, and it starts to happen throughout the body as we continuously get exposed to these allergens. And we are, especially if your allergies are environmental. Okay. And then there's also two types of allergies that we have here. So we have an acute response, and that's your short term. That's like if you come in contact with poison ivy. Okay, it's quick, but it's also short term. You can put some medicine on it, some cream on it. It's kind of irritating for a couple days maybe, but then you're fine, and that doesn't necessarily happen to you again. So what we're really talking about is more of the persistent activation, the repeated exposure. And what happens is you can't really completely recover from it because it's not acute. It's just long lasting. So there's just this continuous recovery. Oh, let's somebody doesn't have their um, mute button on. Let's see if we can fix that. There we go. Okay, so let's move on. The hidden symptoms of immune overdrive. So now we're getting into this constant state of not being able to sleep well or feeling low, fatigued in energy, having lack of focus, having lack of mental clarity. The histamine is a chemical that only doesn't increase inflammation. It also influences the nervous system. And it can even act as a neurotransmitter in the brain. So now we're getting into how histamine affects the brain. Okay, so histamine actually helps us regulate alertness, our sleep and wake cycles. It helps us with appetite, it helps us with attention. So when we get this constant large releases of this histamine because of a reaction, it actually disrupts our normal neurotransmitters from working properly and correctly. It's now affecting our concentration. It's now affecting our mood. We might become more irritable. It's affecting our sleep at this point. And the cytokines actually do the same exact thing. They're not only messengers to drive inflammation, but they're also signal and change the neurotransmitters activities with mood levels. So we're getting more into in depth of just not what symptoms are anymore. We're really getting into is this affecting our serotonin, our dopamine, our norepinephrine? Okay. So all of this affects us as our body as a whole and our wellness as a whole. We start getting into the mind body connection now. All right. So what do we do about it? Right? Well, most of us just take some over-the-counter supplements or we take an antihistamine. Okay. So conventional allergy treatments focus on managing the symptoms as they occur. And this is for immediate effective relief. These approaches work by blocking the body's reaction rather than addressing the underlying immune response, which sometimes is very, very helpful for the immediate. Okay, so we have the antihistamines, which block the histamine receptors. Okay, we have the nasal sprays, which helps reduce all the inflammation that we can get in our sinuses and our nasal passages. And then we have the corticosteroids, which is like your oral, your topical for your rashes and your hives. Okay, so even though this is valuable, even though we need it, even though it can work very, very well, it still doesn't address the underlying cause of what's really happening in the body. Okay, so what we're dealing with here is we're trying to get from this over exaggerated immune response. We want to try to get it under control in general. So we're trying to get to the root cause, but we're trying to do this in a way that's not going to continuously activate the immune system. We need it to calm down a little bit. So we need something that helps us recognize what's happening. The immune system needs to recognize that what the pollen is not harmful, the grass is not harmful. We need to train our immune system to know that these things that we've been completely reacting to aren't actually harming us. Okay, so that way we can start reducing and eliminating symptoms and inflammation in a really slow and gentle way, other than just constantly taking over-the-counter drugs. Okay, so that's where the immunotherapy comes into play. So immunotherapy offers this meaningful advantage over just traditional symptom management. So rather than masking, we're looking at how to create lasting changes for the immune system. So we're going to look at reducing the symptom severity and improve quality of life. We want to reduce the inflammation burden that's happening by recalibrating and reducing the potential, the reducing the inflammation in not just our symptoms, but the whole body over time. And then, yes, we can decrease our medication dependence. We don't have to take all of this other stuff anymore if we can get the immune system under control a little bit better, the inflammation under control. And the immunotherapy really helps retrain and tolerate these allergens better in our bodies. Is immunotherapy right for you? Well, it could be if you have persistent seasonal allergies or even year-round symptoms, if you have brain fog with an allergy history, or if you just have multiple allergy sensitivities, you're just not feeling well in general. So, what do you do from here? Well, you get tested. So we want to identify what's happening in your body, what kind of triggers you're having. So this can be through a skin test, and that's kind of the picture that you see up top, a skin allergy test. Many of you have already received a skin allergy test or have done a blood test. That's where we poke your finger and we put blood on a little card and send it out to the lab. Then after that, Dr. Chan receives your results. And so this is kind of a little bit of an example of what a result might look like. There might be some responses to different types of environmental. This one I'm looking at is an allergy to weeds. From here, we send this out to an allergy lab and they produce actual serums for you based on your own personal reactions, based on your labs. So the treatment involves controlled exposure over months and years, actually, because we do this very gently to the body. So it allows your immune system to gradually build tolerance over time. Okay, so the steps, you get tested, you go over a comprehensive review with Dr. Chan, and then we discuss personalized treatment. We discuss the planning and we go through the education. And then here's the treatment. I wanted to put an actual treatment on here so you can see what it looks like if you don't already. So when the immunotherapy kit comes into the office, you're going to have little vials and then you're going to have a spray. And so um, this kit lasts about a year. It does last a year. You come into the office and you get injected with an allergy serum. Very, very, very small amount. And we do this in stages. So every 12 weeks you get injected and we give you education. What's happening? How are you feeling? And then you write down in a log. And so you can see here that there's a sample log. I just kind of took a picture of the first page, but it kind of goes through the year immunotherapy treatment, the first, second, third, and fourth week, and kind of what happens as we build an immune tolerance. This spray is a treatment that's sprayed underneath the tongue and held for 30 seconds. And you do that 3 times a week, or you inject yourself with a little bit of the vial serum. So we kind of give you options on which you prefer and what feels comfortable for you. Through this time, we're supporting you, we're educating you. With administration, we follow up with you. The hope, the intention is to reduce the inflammation through the immunotherapy. We want you to have more improved cognition and less fatigue and more energy. So, clinical evidence shows that allergy symptoms can increase cognitive decline. That's huge. That's clinical evidence and research. So, we come in thinking, well, if that's the case, then what if we can reduce the inflammation, reduce the allergy symptoms? What does that mean for you? It could be pretty meaningful. So, with the reduce of the histamines and the cytokine levels, which we're trying to lower, we are hopeful to see better attention, learning memory, sleep cycles, better wellness in general. Okay, basically we're just trying to rebalance and recalibrate the immune system, lower inflammation levels, get you feeling better, but it's a kind of a slow process. It's a longer amount of time that needs a little bit of attention on your part. So, what we discussed today was just how the immune system interprets responses to the environment around you. We talked about some of the approaches that you can take to your allergies, and then the immunotherapy, which we feel is a great benefit to your health and wellness and to whole body in general to increase vitality. Okay, that is our presentation. Thank you so much for this. And I'm actually going to see if Dr. Chan is around to answer any questions that any of you have. So let me stop this here.
Hello, guys. I am here.
Oh, Dr. Chan, we can't see you. Oh, there you are. We
Yeah,
can.
I've been listening attentively. Thank you. Great job. Thank you. Great job.
Thank you.
Yeah.
Okay,
So,
anybody have any questions? You can unmute yourself or raise your hand or type in the chat box, whatever it is that you like. I know I explained this so thoroughly, but Dr. Shan is here,
yeah,
so
I almost felt like I went go back to med school for a lecture. So it's good. So hopefully it's not too intense, right? I feel like, because all we need to know is, well, why are you so into allergies? Because allergies raise inflammation, right? So when we treat allergies, then of course my allergy symptom could be improved. But what is more important is, well, the side benefit, right? The extra benefit is I reduce my inflammation. And by reducing that overall inflammation, then I become healthier. I become younger. I become more functional. And right, and that includes improving my brain function. It also reduces risk for heart disease, right? And reduce joint pain. How about that? Right? So anything that has to do with inflammation would be improved, right? By allergy treatment. But I feel like we don't focus enough because most people, when you talk to them about, well, what do you do to decrease inflammation? The focus has always been, and rightfully so, on your lifestyle, right? That's why Heather is here to become my health coach to focus on lifestyle. Yeah, you've got to focus on your diet, your exercise, your sleep, how to manage stress, right? And of course, there's so many other tools that we use on helping patients to become younger, right? And that would be like, optimizing my hormones and doing IV nutrition therapy, doing peptides, which is big now, right? Pretty, popular, and even doing cellular therapy, right? Using exosomes. But the problem is none of that is covered by insurance. So, how can I help more people? Right? My job as a doctor, is to help hopefully as many people as possible. And to me, there's always a social component. I know, I have, I'm grateful, I'm blessed, to be able to have, be able to be a doctor in a, so-called concierge setting. But I think being a doctor, I have to do more than just that, right? So I focus more and more on allergies because I want to make that connection where, well, treating allergies can also reduce inflammation. So yes, you can do all the diet, exercise, and peptides and stem cells and hormones, but if you can do that, that will have an additional benefit and add an additional layer to the entire anti-inflammatory program. And the good news is most insurance pay for allergies. Right? So yay! So I'm jumping into it. I hope that I truly hope that I can touch more people with that approach. Treating allergies, then we can also reduce inflammation, and I can help create a healthier patient population. In fact, we plan to do this more frequently. Like I'm trying to come up with an educational program so I can meet my current patient who is doing therapy with me right now, right? Perhaps once a quarter, and we do some type of educational engagement event like this, so that we can create a community on how treating allergies would also benefit inflammation, reducing inflammation, so that we can all become healthier. And of course, for me, I want to be younger and younger, right? Like many of you would like to be as